PCA Practice Test 2026 Personal Care Assistant, Full Course Scope of Practice. Question 1. Which of the following is considered an activity of daily living, ADL, within a PCA's scope? Administering 4 medication. Bathing and dressing. Adjusting a ventilator. Diagnosing a skin rash. ADLs include basic self-care tasks like bathing, dressing, and eating. Question 2. True or false, a PCA can perform sterile dressing changes on a deep wound? True. False. Sterile procedures are typically outside the scope of a PCA and require a licensed nurse. Question 3. Can a PCA assist a patient with self-administration of medication by opening a bottle? Yes. No. Only if the PCA is also a nurse. Only for narcotics. Assisting with self-administration, reminding, opening bottles, is usually allowed, but administering the med is not. Question 4. Which of these tasks is a PCA typically not allowed to do? Emptying a urinary drainage bag. Trimming the nails of a diabetic patient. Recording intake and output. Assisting with a walk. Nail care for diabetics is risky due to circulation issues and is usually reserved for nurses or podiatrists. Question 5. If a PCA notices a new red area on a patient's hip, what is their scope-defined responsibility? Apply a medicated cream. Massage the area. Report the observation to the supervisor/nurse. Wait until the next day to see if it clears. Reporting changes in skin condition is a vital part of the PCA's role. Question 6. A PCA is asked by a family member to give the patient their insulin. The PCA should do it to be helpful, politely refuse and explain it's outside their scope of practice, ask the patient how much they usually take, give it only if the nurse is busy. Giving injections like insulin is a medical task outside the PCA scope. Question 7. Is assisting with meal preparation and feeding part of a PCA's duties? Yes. No. Only in hospitals. Only for infants. Nutrition assistance is a core component of PCA services. Question 8. A PCA can perform which of the following regarding vital signs? Measuring and recording blood pressure. Interpreting what a high blood pressure means. Prescribing medication for high blood pressure. All of the above. PCAs can take measurements, if trained, but cannot interpret or prescribe. Question 9. Who supervises the work of a personal care assistant? The patient's family. A registered nurse, RN, or qualified professional, QP. The front desk clerk. No one, they work independently. PCAs work under the supervision of a licensed professional, RN or QP. Question 10. Can a PCA perform range of motion exercises with a patient? No, that's only for therapists. Yes, if it's part of the established care plan. Yes, but only for athletes. No, it's too dangerous. Assisting with exercise as directed in the care plan is within the scope. Question 11. Which of the following describes scope of practice? The area where the PCA lives. The list of tasks a professional is legally allowed to perform. How many hours a PCA works. The PCA's salary range. Scope of practice defines the legal limits and responsibilities of a job role. Question 12. Can a PCA provide transportation for a client in their own personal car? Yes, always. It depends on the agency policy and insurance. No, never. Only if the client pays for gas. Policies on transportation vary by agency, some allow it with proper insurance, others forbid it. Question 13. What should a PCA do if asked to perform a task they haven't been trained for? Try their best anyway. Refuse and inform their supervisor. Ask the client to teach them. Look it up on YouTube. Safety is paramount, you must never perform tasks you aren't trained for. Question 14. Assisting with a bedpan is part of toileting assistance, medical therapy, physical therapy, housekeeping. Helping with elimination is part of the toileting ADL. Question 15. A PCA can help with light housekeeping. This includes cleaning the patient's immediate area and doing their laundry, mowing the lawn, painting the house, fixing the roof. Light housekeeping refers to tasks that maintain a clean/safe environment for the patient. Question 16. Is a PCA responsible for observation and redirection of behaviors? Yes. No. Only for children. Only for pets. Observing and managing behaviors is a key part of caring for clients with cognitive deficits. Question 17. A PCA sees the patient is choking. What is the immediate responsibility? Wait for the nurse. Perform the Heimlich maneuver, if trained, and call for help. Give the patient a glass of water. Walk away to find a phone. Emergency response within training, like first aid, is expected. Question 18. True or false, a PCA can change a colostomy bag if trained by a nurse? True. False. In many states, PCAs can assist with stable colostomy care if specifically trained and supervised. Question 19. Which of the following is not a PCA's responsibility? Documenting care provided. Reporting changes in condition. Adjusting the dose of a patient's heart medication. Assisting with grooming. Medication adjustment is a high-level medical decision. Question 20. If a patient is upset and crying, the PCA should tell them to stop. Provide emotional support and companionship. Ignore it. Leave the room. Companionship and emotional support are core PCA functions.